In this room in Montana, they're discussing two bills. One that aims to ban sex change surgeries, puberty blockers, and hormones for minors, and another that wants to hold doctors liable for 25 years if a patient suffers physically or psychologically from the procedure. Naturally, a group arrived to speak out against both bills.
I can tell you, based on vast clinical experience, that gender-affirming care for young people is not abusive. It is not experimental. It is not dangerous. It is evidence-based, and for those who need it, it is life-saving.
I was assigned female at birth by a doctor who I was in the same room with maybe 1 week of my life, and to this day, the only thing female about me is my birth certificate.
Our lives tossed around like pieces of popcorn so that media companies can drive up profits and engagement.
Instead of continuing down this path of admonishing and criminalizing the people who support young trans, non-binary, and two-spirit people in Montana, we would really hope that this body would work on policies that uplift young people.
This bill spits in the face of my informed decision to have gender-affirming care, and indeed anyone who made that decision. It tells them they are not smart enough to make their own medical decisions and babies them for making the wrong choice according to the government.
Trans people are at a higher risk for suicide not because of their gender identity, but because of how they are mistreated by society. By voting no on this bill, you can make a difference in decreasing the depression and suicide rates for trans youth. You can show parents that they have the power to choose what is best for their children, and you can show doctors that their expertise means something in the eyes of the law.
When I was 14, I came out to my doctor and my family, and I told them I really need to be on hormone blockers because I cannot stand the periods that I was having.
What is the purpose of us being here today? Is it to divide families? Is it to put parents in a position of terror, trying to decide how to appropriately support their kids, or be thrown in jail for doing so?
My nephew was born without a penis. As he grew, it became obvious to my sister and brother-in-law that their child was clearly disturbed by being made and expected to act as a girl. After extensive counseling and observation throughout his early and middle childhood, he was diagnosed with gender dysphoria around the age of 9. After more years of counseling and observation, his doctors advised that his puberty be medically delayed to preserve a reversible opportunity for optimal medical outcomes later.
Growing up as a trans person with no access to gender-affirming care was one of the hardest things I've ever had to go through. I would not wish it on anyone. Puberty was horrifying for me. Seeing my body become more readable as female as I aged was like waking up and realizing I'd grown a third arm.
Bills that attempt to block young people from accessing gender-affirming care are rooted in a fundamental misunderstanding of the process. In the vast majority of cases, children are not taking hormones or getting surgery. Instead, trans kids choose clothes that align with their gender, a name that feels right for them, and participate in gendered activities such as sports or scout programs. Hormones and surgery require parental consent, and lengthy vetting processes often lasting years. Additionally, despite this bill's assertion that puberty blockers endanger children, the same treatment has been in use for over 30 years to delay early onset puberty. When used to treat gender dysphoria, puberty blockers allow patients more time to figure out their identity, so if they decide transition is not for them, they can stop at any time.
This bill, which purports to protect young people, is causing them harm even before it has been enacted. This client of mine is in their early teens, just entering puberty, and they have a clear understanding that their gender does not align with their sex assigned at birth. In therapy with me, they expressed their desire to explore options for starting hormones or blockers before their puberty advances further.
1 minute.
So with my guidance, their parents, who are loving and fully supportive, recently scheduled an appointment with an endocrinologist to discuss an assessment and possible treatment options. During that appointment, my client was subjected to a truly traumatizing experience, listening as the physician informed their parents that if SB 164 were to pass, proceeding with any gender-affirming care for my client could lead to both the doctor and their parents being arrested and imprisoned. My client was devastated. Imagine your own child being placed in this situation, told that the price of their own care and well-being is the loss of their parents. Would you stand for it? Can you vote for a bill which causes such harm?
No other type of healthcare is banned in Montana, and we need to remember that every major medical association in America supports the provision of gender-affirming care for the treatment of gender dysphoria.
This representative of the ACLU faced some hard questions.
What specific age does the ACLU believe a child possesses the maturity and understanding to consent to medical interventions that result in permanent sterilization?
Chair Representative, I believe that's a question for a doctor.
So you won't give a specific age, so you suggest that any child...
Chair Representative, I'm not a medical professional.
Madam Chair, so do you think that any child at any point should just be able to consent? Is that the ACLU's position?
Chair Representative, the ACLU position is to follow the medical advice of doctors.
Madam Chair, another question. So I guess different subject then. So given the serious risks that, these puberty blockers, there were some examples today, about I know you say you're not a doctor, but, decreased bone density, fertility issues, impacts on cognitive development. The ACLU's mission is to protect civil liberties. Doesn't this, potentially impact civil liberties of people, putting these irreversible, harmful, treatments and medications on people?
Chair Representative, the ACLU is here to make sure that people can get medical treatment. I think that the questions that you were asking have to pertain to the expertise of a doctor, of which I am not.
Thank you, Madam Chair. I'd hope an organization with a $40 million operating budget would hire better lobbyists. Thank you.
This whistleblower spoke out in favor of the bill.
I am from St. Louis, Missouri. I am a whistleblower from a pediatric gender center. I worked with nearly 1,500 patients from the age of 3 until the age of 26, and I worked in pediatric gender medicine for nearly 5 years. I live in a state now that has restricted the use of puberty blockers, cross-sex hormones, and surgeries, but it was too late for many of my patients. It was too late for my patient who had top surgery and called us within 3 months begging for the surgeon to put her breast back on. The surgeon refused to speak to her, and I was forced to instead. Another patient, a young woman put on testosterone, called our center. She reported that she was bleeding heavily. We told her to use a heavy pad and call us back in an hour if she bled through the pad. She called us back within 20 minutes. She had bled through the pad, her blue jeans, the towel wrapped around her waist, and soaked her bed comforter. She required emergency surgery to repair her torn open vaginal canal because the testosterone had so degraded her vaginal tissues. When I told the prescribing doctor that we needed to report this as an adverse event, I was told that this was completely expected with testosterone and that I wasn't allowed. The doctor who prescribed that testosterone simply left my state when we passed this law, and he now moved to another state to continue these practices. We require criminal penalties for doctors to stop these practices, or else they will continue to simply move and move and move to continue to harm patients. What I know from firsthand experiences is that these doctors will not stop unless you create the mechanisms in order for them to cease. In addition, patients harmed deserve the right to seek justice for their harms and need you to step up and do the right thing for patients across this country.